This week, the Saskatchewan government announced new measures against the sale and use of meth and fentanyl, including new penalties for unauthorized production, transportation, and distribution of the two drugs. It will also cancel provincial licenses for those convicted of drug-related crimes, including driver's licenses, firearms licenses, hunting and fishing licenses as well. And the government said it would look at allowing convicted criminals to receive credits against court-imposed fines if they complete addictions programming. As we heard a little bit earlier in the show, Alberta is taking things a step further. The government announced it plans to spend $180 million over 3 years to build 2 involuntary drug addiction treatment centers. Tim MacLeod is the Minister of Justice and Attorney General for Saskatchewan. He was asked about what he thinks of Alberta's plan.
I would say that we're looking very carefully at it. So Alberta has been talking for some time about their involuntary treatment. Saskatchewan's been watching with a keen eye on that piece of legislation and the development of it. We're certainly watching very carefully and are considering what our options might be in that same space. Right now, of course, we've taken a small step in that direction when it comes to the complex needs emergency shelters in Saskatoon and Regina, where we have individuals who are posing a threat to themselves or to the community, able to be detained for a short period of time until they're no longer a threat. And then, of course, the key piece of that is connecting those individuals with the community services that they require that they were unable to find on their own.
That was Tim MacLeod, the Minister of Justice and Attorney General for Saskatchewan. Barb Fornssler is an assistant professor, of the School of Public Health at the University of Saskatchewan, and Barb joins us now to talk about this. Good morning, Barb.
Good morning, Adam. Thank you so much for having me.
You're welcome. Barb, let's start off with Tim MacLeod's comments. You heard the minister there. What's your reaction to the minister saying that they're looking at what Alberta's doing when it comes to involuntary treatment centers?
Yeah, that's right on trend. The Saskatchewan government seems to watch what Alberta's doing and often take similar measures following on their heels in drug policy approaches. Overall, I think what we need, as the minister mentioned, strong evaluation of the complex needs facilities that are in operation, I think could also be another great mechanism to inform Saskatchewan's approach to this kind of forced treatment approach that is going on in Alberta, or it is proposed in Alberta. And I always, as a researcher, am wanting to ensure that there's strong evaluation and strong mechanisms in place to change things should these measures align with evidence, which is basically that punitive measures and forcing people into treatment have not shown to be effective. And so I want to ensure that Saskatchewan isn't heading down, another poorly thought pathway in its substance use policies overall.
Can you talk about the research when it comes to these involuntary treatment centers? We've seen the Alberta government call them compassionate intervention. You mentioned the word forced there. So different labels for the same thing, it seems like.
Mm-hmm. Yeah. And I mean, one of the challenges that we do face in the research world is, a lack of evaluation and evidence around some of these approaches. If we parallel it to things like the prison system, what we see upon release from the prison system is often a much higher rate of overdose and exposure to drug toxicity following that release. You might be able to drag someone into a center, force them to stop using substances at that time, but when the opportunity becomes available again, they will take it because we haven't addressed those underlying drivers of substance use, which is really rooted in trauma and a lack of available resources otherwise in life, right? So if you're not having access to housing, to secure food sources, to employment opportunities, all of those things are what help protect people from the harms of substance use. They don't feel the need to use substances when they're not in the midst of living in a survival mode or facing additional challenges. It's a lot easier to address the harms of substance use and ensure safer use. So what we've seen from other punitive measures is really reduced health outcomes, more harm to the individual and to our communities. And we want to ensure that we're taking a health-focused approach rather than sort of mimicking the criminal justice system within our healthcare system.
One of the arguments from the Alberta minister responsible, we played a tape from him a little bit earlier in the show, was that some addicts in these cases they can't help themselves. Were his words. I'm paraphrasing a little bit, and that involuntary treatment or compassionate intervention, as he's calling it, is a way to help people that need it when they don't realize they need that help, or they're close to death. He was talking a lot about being near death and overdosing. Does that carry any weight with you, that argument?
I think overall, we're all very concerned about wanting to support people who use substances and who are in that vulnerable and marginalized state. At this point, though, I would ask, I guess, if folks have had the opportunity to voluntarily access treatment. We know that there are long wait times for our current system, often requiring repeat calls to try and access those services. So until we have, wide access to voluntary treatment and not a 4-week plus wait to access those services, I'm not clear on why we're taking up this idea of a forced treatment model. We don't have the capacity for those who would voluntarily like to go at this stage. And often that resistance to going to treatment is rooted in the need to build trusting relationships with care providers and with our health system. And we can do this best by having, harm reduction focused community organizations connecting with those individuals, building those relationships, and offering a safer pathway to care, rather than trying to, have the police show up and force people into this situation.
When it comes to the other changes that were made by the government, obviously the involuntary, we're getting a little ahead of ourselves because we don't know Saskatchewan's down this road. The minister didn't rule it out, though, and you mentioned that Alberta, sometimes we follow Alberta when they're introducing legislation or new laws or new rules. When it comes to the other changes that were made this week, I know there was a lot of attention over considering pipes or needles as weapons. I listed some of the other things Saskatchewan did this week. What stood out to you from those changes?
What really, I think the message that reached the public and certainly myself based on the news coverage is that Saskatchewan is leaning into a punitive approach to addressing substance use in our communities. And unfortunately, that punitive approach and that war on drugs framing has unfortunately just increased the harms in our communities over, since the 70s, when this approach really took form and took off. What we see from these kinds of punitive approaches, including criminalization or harming folks in different ways, is that it increases the violence in our communities. It marks people with criminal records, and it unfortunately leads to an even more harmful unregulated drug supply. So when we're really forceful, in a sense, coming at it from an enforcement perspective, quite often what the unregulated market does is respond with wanting to make packages smaller and make amounts more easily transported and hideable, so they can be hidden. And this unfortunately introduces substances like fentanyl, carfentanil, and others that are going to increase the potency with a lesser amount. And that puts people in great danger because they can't control the dose and amount of substance that they're using. It can be more easily cut into other substances and hidden. And so overall, I'm really hoping that Saskatchewan will, not follow in Alberta's pathway on this particular policy. I think we're going to see, unfortunately, that punitive response is going to drive people away from the health system, isolate them further, and potentially put more people in harm's way. It definitely concerns me that we're thinking about, tying things like driver's licenses to this kind of thing. It's really hard to get a job without a driver's license. And we know that people having, recovery capital, social relationships, economic relationships, and ties to their community is one of the strongest factors in recovery and in maintaining that recovery. So it seems to go in the opposite direction of where we should be going, based on the research evidence and based on the things that we have seen are effective in addressing substance use harms in our communities.
Barb, what could be some alternatives? You've talked about increasing, I think, access to care in not a volunteer, let's say, basis here in the province, and some barriers that exist right now. We have a treatment center outside of Regina in Lumsden that's had troubles being fully staffed and hasn't gotten off the ground. is that the first step here, to staff up those places, to give people a chance to go somewhere voluntarily and not be, in the system, whether that's eventually potentially an involuntary place or even within the justice system?
Absolutely. Having available resources within our healthcare system is going to go a long way toward supporting people where they're at. One of the other really important elements, though, is not only focusing our efforts on those acute care beds, right? When someone is needing that residential treatment support, it's often because they've been experiencing the harms of substance use for quite some time. And what we need to do is get there earlier, get there before that chronic health need has developed. And we can best do that by having a fuller continuum of care where we are looking at everything from prevention, harm reduction, early intervention and outreach. And we can reduce the demand for those kinds of, frankly, the most costly options in our health system is that residential care, and we can ensure then also that people have supports for community-based supports and services. So that's things like ensuring we have a full range of supply distribution for harm reduction. We need to not criminalize having a sterile syringe. Saskatchewan's HIV rates are significantly higher than the national rates. We have 19.5 infections per 100,000 people. The national rate is 6. And we know that the primary driver of that is injection drug use in Saskatchewan. So we actually need to provide more syringes, which is sterile supplies, and ensure that people have access to those without the threat of being charged with a weapon. This was a concern when needle exchange programs were rolled out in our prison system, that they would be used as weapons, and that fear has not materialized. So that might be a good indicator that folks need this for health purposes more than anything else. So hopefully we can develop a full continuum of care where we're not trying to punish our way out of substance use harms, and instead are supporting people to make those changes in their lives.
Barb, thanks so much for your time and expertise this morning. We appreciate you joining us.